There's been a setback in the fight against COVID-19 in many parts of the world. Canada and other countries may be moving ahead with reopening plans, but the global picture shows the pandemic is worse than ever. Yesterday, the World Health Organization reported more than 183,000 new cases around the world. The news comes as some countries show worrying signs of a second wave.
There was no masking emotions at Madrid airport as Spain finally ended its state of emergency. The tourism destination has reopened its borders to most European Union countries. And many of the countries that had been doing well are now showing signs of a second wave. Almost half of the new cases on Sunday came from Brazil and the US alone.
China wants to be a staunch contributor to regional and global peace and development. So what defines China's policy in this, and how can it help fulfill the UN's Sustainable Development Goals?
Since the coronavirus was first identified in Wuhan in December, Chinese authorities have punished doctors for raising the alarm, detained citizen journalists for reporting on the epidemic, and removed social media posts critical of the government's handling of the crisis.
Violence broke out in Germany when 700 people in an apartment block were quarantined. The country had been doing a better job than many European nations, but the reproductive number of the virus there is now thought to be above 2 or even close to 3. The R number needs to stay below 1 to keep the spread in check. More than 1,000 workers also tested positive at this German meat processing plant.
Explodierende Zahlen.
The state premier says he won't rule out new lockdown measures. South Korea has been one of the success stories of pandemic management. But officials say a small but significant second wave has arrived much earlier than expected.
South Korea, with other countries, demonstrate that even when you get down to very low incidence, you still have to have a very strong public health surveillance system.
In the U.S., where the first wave is still accelerating, some states are reporting more cases among younger people.
A record for new cases was set Saturday in California. ICU beds becoming scarce in Arizona. In Texas, some counties are making masks mandatory after Austin and San Antonio became 2 of the 5 hotspots in the country.
We are filling the stockpile in anticipation of a possible problem in the fall.
New York, once the country's epicenter, has better news, entering phase 2 of its economic reopening.
Hundreds of thousands of people will be going back to work.
Experts say people need to keep practicing prevention, frequent hand washing, physically distancing, and avoiding large crowds. But the country's lockdown has taken its toll.
As more long-term care homes are declared virus-free, they're taking in new residents to fill the hundreds of beds left vacant by those who have died from COVID-19. But filling those empty beds is opening up new concerns. Ross Lord explains.
After losing 17 residents to COVID-19, the Mark Haven nursing home in Markham, Ontario has declared the outbreak over. Management says it's refilling empty beds. Some families oppose the move.
I think it's too soon, and I don't know what the plan is.
Management says it's very confident in screening procedures, noting the Ontario government is providing extra funding to allow for increased staffing. But at a devastating time for many long-term care homes, balancing residence numbers with staffing levels is a big challenge.
What's keeping us up at night right now is we have fewer staff in long-term care right now. We're not sure that those who left and are at home right now are going to be willing to come back. The stigma is so great. This is critical.
The failure to prepare could allow the next epidemic to be dramatically more devastating than Ebola. If it had gotten into a lot more urban areas, the case numbers would have been much larger. So next time, we might not be so lucky. You can have a virus where people feel well enough while they're infectious that they get on a plane or they go to a market. The source of the virus could be a natural epidemic like Ebola, or it could be bioterrorism. So this is a serious problem. We should be concerned. But in fact, we can build a really good response system. We have the benefits of all the science and technology that we talk about here. We've got cell phones to get information from the public and get information out to them. We have satellite maps where we can see where people are and where they're moving.
As more states work to reopen, knowing who has the coronavirus is going to be key. And one way to do that, it was something called contact tracing. That's about tracking down anyone who may have come into contact with a person who has tested positive. New York City, for example, says it plans to hire 1,000 people to help with that effort by the end of the month. Nationally, experts say it will take an army of people asking all the right questions.
Their mission is to break the chain of infection by developing a list of everyone who may have been significantly exposed to a patient, then urging those close contacts to monitor symptoms and self-quarantine. Thomas says she can usually reach about 60% of the patients she tries, getting all the information she needs in less than 30 minutes.
And speaking of the future, technology is also expected to play a really big role in this effort. Google and Apple later this month are expected to debut a tool, an app, allowing people to receive an automatic alert if their phone has been near another phone of a person who is COVID positive. But for many people, that brings up big privacy concerns, Gail. And in fact, a recent poll found that more than half of Americans, even if such an app existed, would not be willing to use it, at least so far. We're, of course, going to be covering that as the technology begins to roll out. But contact tracing, it's a term we've heard a little bit. We're going to hear it a whole lot through May and into the summer. I'm sure of that, Gail.
Contact tracing apps were supposed to save us. But as the country gradually reopens after lockdown and eases social distancing measures, many states are now seeing a surge in new reported coronavirus cases. And while some states are attempting to build their own manual contact tracing programs with armies of human tracers, there are still very few apps built to track the spread of the disease, even as Silicon Valley proclaimed the technology's potential. API developed by Apple and Google. It's not an app itself. It's a set of protocols and tools that public health agencies can use in their own apps. Only 3 states so far have committed to using it. So what happened? At its core, the conversation is really about a trade-off between privacy and public health. While the Apple-Google API has received approval from even the staunchest privacy advocates, officials say its restrictions limit how effective they can be. For one, the API doesn't allow governments to collect any GPS location data. Instead, it operates on Bluetooth, which could theoretically keep identities anonymous by using unique, temporary IDs. These IDs would be generated by a person's phone once they downloaded the app and opted into the system. They would change every 15 minutes, and all data would be stored locally on users' devices. And so, if 2 people running the app spent a certain amount of time near each other, say 20 minutes within 10 feet, or whatever public health officials decide, their phones would exchange IDs. If one of those people is later diagnosed with COVID-19, that person can opt to upload all of their IDs from the last 14 days into the app server. If there's a match, the app will tell you that you've been exposed to someone with COVID-19 and warn you to get tested or self-isolate.
It really is far too. You can't tell whether there was a wall between you and another person. You can't tell whether you're on the same floor quite often. I mean, if you've ever tried to connect to somebody else's Bluetooth appliance, you can see that it really isn't a substitute for the kind of thing that a contact tracer, a physical contact tracer, is trying to get to, which is, did you pass the virus to someone? You also have to look at, before we even get to these guardrails, the fact that not everybody has a smartphone with the most up-to-date thing. So you're never going to get 100% of the people involved in this. And in fact, it's going to be slanted towards wealthy people, people who have the means. So how are we going to account for that when we know that many of the people who are most vulnerable to coronavirus are not that community?
The rate of adoption is extremely important. You need to have high adoption for these apps that do proximity tracing to have value, because if only 1 out of every 100 cases uses this app, then the app isn't going to be very useful for finding all of the cases. And I think there could be a false sense of security if I don't download an app as a community person and I think, oh, the app is going to tell me when I'm near a case when I go outside. So I'm kind of protected by it. But most of the people who our cases aren't using it, that's kind of a false sense of.
And the fact that we have a shortage of people who are doing this and we need to train them up, we can use all sorts of digital tools to help us train up people to do physical contact tracing. And I think get a lot better bang for our buck about how we're doing this than the apps.
As the world waits for a coronavirus vaccine, the U.S. is trying various methods to contain the virus. That includes what's known as contact tracing. But last week, the nation's top infectious disease doctor, Anthony Fauci, told reporters contact tracing is, quote, not working.
What we're dealing with right now is community spread in the context of a substantial proportion of the people who are getting infected do not know they're infected, they're not symptomatic, they're asymptomatic individuals. The classic paradigm of identification, isolation, and contact tracing to actually contain that is very difficult to make that work under those circumstances. You superimpose upon that the fact that even with identification, isolation, and contact tracing, often the dots are not connected.
We have advances in biology that should dramatically change the turnaround time to look at a pathogen and be able to make drugs and vaccines that fit for that pathogen. So we can have tools, but those tools need to be put into an overall global health system, and we need preparedness. The best lessons, I think, on how to get prepared are, again, what we do for war. NATO has a mobile unit that can deploy very rapidly. NATO does a lot of war games. So those are the kinds of things we need to deal with an epidemic. What are the key pieces? First is we need strong health systems in poor countries. That's where mothers can give birth safely, kids can get all their vaccines, but also where we'll see the outbreak very early on. We need a medical reserve corps. Lots of people who've got the training and background who are ready to go with the expertise. And then we need to pair those medical people with the military, taking advantage of the military's ability to move fast, do logistics, and secure areas. We need to do simulations, germ games, not war games, so that we see where the holes are. The last time a germ game was done in the United States was back in 2001. And it didn't go so well. In fact, if there's one positive thing that can come out of the Ebola epidemic, it's that it can serve as an early warning, a wake-up call to get ready. Germ games, not war games. Germ games, not war games. Germ games, not war games.
Welcome back. Microsoft co-founder Bill Gates was just named one of the 8 men who combined possess more wealth than half the world's population.
A number of countries and foundations are coming together to look at making vaccines in advance of an epidemic so that we can have platforms that are very quick to make new vaccines. And so we're far more ready than we were when the Ebola epidemic hit. And so that's a big contribution. It's a response to the fact that the vaccine didn't get done for Ebola until after the epidemic was gone. What's being announced is $460 million that'll be given out in grants for specific pathogens that there's concern about, but the focus will be on using an approach that even if it's a new disease, we could make a vaccine more rapidly. Well, I don't have a crystal ball. Obviously, we've got new people, the opportunity to talk about U.S. leadership, what's gone on where the U.S. supported the Global Fund, it supported the Gavi Fund for vaccines, how we continue that type of outreach and how it helps our security, that we're helping those countries both be healthy and be stable. There'll be some great conversations and, hopefully some ideas about new investments that can be made here.
Look, here we are on the eve of the inauguration, Bill, and we're looking at a completely new approach to so many of the most important issues that the world faces. We've got business people coming in, running government agencies. What do you think? Is this going to work?
The U.S. government plays a super important role in the world. It's been a great partner of ours in the foundation work. The Bush administration was a very good partner. That's where Global Fund got started. The Obama administration carried it forward and stepped up during Ebola. So, we're excited to reach out and see what this next chapter can look like. Our commitment to global health is going to stay steady, for the rest of our lives.
Madam President, Mr. Secretary General, world leaders, ambassadors, and distinguished delegates, 1 year ago, I stood before you for the first time in this grand hall. I addressed the threats facing our world, and I presented a vision to achieve a brighter future for all of humanity. Today, I stand before the United Nations General Assembly to share the extraordinary progress we've made. In less than 2 years, my administration has accomplished more than almost any administration in the history of our country. America's so true. Didn't expect that reaction, but that's okay. America's economy is booming like never before. Since my election, we've added $10 trillion in wealth. The stock market is at an all-time high in history, and jobless claims are at a 50-year low.